Hey, what is up you guys, and welcome to Jane's Medical SBAs. They say the best way to learn is to write your own questions and teach, so here we go. SBA number 1. A 38-year-old female presents with excessive sweating, weight loss, and increased feelings of irritability. Thyroid function tests are conducted, and the following results are noted. She has elevated TSH, T3, and T4. Now, based on the most likely diagnosis, what is the single most definitive treatment? A. Levothyroxine. B. Carbimazole and levothyroxine. C. Propranolol. D. Transphenyidal resection of the pituitary gland. Or E. Radioiodine. I'll pause the video here if you want to have a think about the question and answer it yourself. I actually can't hold my breath for that long. Now, the single best answer is, of course, D, transphenyidal resection of the pituitary gland. Now, let's explain why that's the correct answer. The patient's symptoms of excessive sweating, weight loss, and increased irritability hopefully made you think about hypothyroidism. Now, let's just revise the hypothalamic pituitary thyroid axis real quick. Now, the hypothalamus secretes TRH, thyrotropin-releasing hormone, which acts on the pituitary gland to release TSH, thyroid-stimulating hormone, which in turn acts on the thyroid to release the hormones T3 and T4. Now, normally, elevated levels of T4 and T3 act in this negative feedback loop, which results in the reduction of TSH and TRH secretion by the pituitary and hypothalamus respectively, which in turn results in the reduction of T4 and T3 hormone, and everything is kept in balance. Now, in primary hypothyroidism, which happens at the level of the thyroid gland, the most common cause of which is Graves' disease, which is due to autoantibodies that act agonistically at the TSH receptor, which stimulates the thyroid gland to release more T4 and T3. There are elevated levels of T3 and T4, but suppressed levels of TSH, owing to this negative feedback loop that we mentioned before. Secondary hypothyroidism is caused by pathology at the level of the pituitary, for example, a pituitary adenoma or a tumour, which might be producing too much TSH. This then results in overstimulation of the thyroid and the increased levels of T4 and T3. The main difference between this and primary hypothyroidism is that the negative feedback loop, which ordinarily would occur due to elevated hormone levels produced by the thyroid gland, is broken, because in this case the problem is with the pituitary itself producing too much TSH, say because of a tumour, which isn't going to respond to a negative feedback loop telling it to stop. Okay, back to the question. Now here, our patient has elevated levels of T3, T4 and TSH, suggesting that she has secondary hypothyroidism. In other words, the source of her problem is at the level of the pituitary and not the thyroid, which is likely due to a pituitary adenoma. So therefore, the definitive treatment is of course going to be to resect the pituitary. Now, let's look at why everything else is wrong. A. Levothyroxine. Now this would be giving her more thyroid hormone, which is the treatment for hypothyroidism where you lack it, not hyperthyroidism where you have too much of the thyroid hormone. Giving levothyroxine would just make her symptoms worse. B. Carbimazole and levothyroxine. Now this is the classical block and replace treatment for primary hypothyroidism, that is elevated levels of thyroid hormone due to a pathology at the level of the thyroid. Carbimazole blocks the production of thyroid hormone from the thyroid gland, and levothyroxine replaces the hormone at an appropriate level. But our patient has secondary hypothyroidism, not primary, so this wouldn't be dealing with the source of the problem. C. Propranolol. Now this beta blocker would have a role in managing the symptoms of hypothyroidism, but it wouldn't be the definitive treatment. And finally, E. Radioiodine. Iodine is essential for thyroid function, so radio or radioactive iodine gets easily taken up by the thyroid gland, but because it's radioactive, it results in ablation of thyroid function. Now this would be a way of treating primary hypothyroidism where the pathology is at the level of the thyroid gland itself. But again, the problem here is at the level of the pituitary, as it's secondary hypothyroidism, so transphenyidal pituitary resection is the definitive treatment. And there we have it, SBA number 1, secondary hypothyroidism. So if you learned something in this video and found it useful, please do give it a big thumbs up. If you want to see more content like this, do yourself a favour and hit that subscribe button over there. If you want to learn about classic medical school topics but in a random and fun way, do check out my medical evidence playlist down here. If you want to know more about who I am and what exactly I'm doing, do check out my introductory video over here, where you can learn more about the mbphd program. Okay, that is all. Thank you so much for watching, guys, and I will see you next time. Bye for now.